Hi class, this is Kristen Lazarova and welcome to chapter 3 where you're going to be learning about stress and its effects. I've divided this chapter into two parts or two videos. In the first video, you're going to be learning about the nature of stress. You're going to learn about the characteristics of stress, how stress has been studied, how we can measure it. You're also going to be learning about the different types of stress. You'll learn about chronic stress, acute stress, anticipatory stress, internal conflict. You'll also learn about the pressure to perform and the pressure to conform. These are just a few of the things that you'll be learning about in part 1. In part 2, you're going to be learning about the effects of stress. So let's get started. Before we get started, consider what you think. How would you respond to this statement? Minor stressors like daily hassles can have major effects on mental and physical well-being. Do you think this is definitely false, mostly true, or definitely true? What do you think the research has to say? If you selected definitely true, you're right. We're going to be looking at the effects of stressors on both our mental and physical well-being in this chapter. What about this particular statement? Evaluations of stressful events can alter the impact of these events. Do you think this is definitely false, mostly true, or definitely true? If you selected definitely true, that's what the research supports. How we interpret stressful events has a significant effect on how these events affect us. What about this one? Post-traumatic stress disorder only occurs in the aftermath of trauma due to combat or terrorism. Is this definitely false, mostly true, or definitely true? What do you think? If you selected definitely false, you're right. We're going to be looking at PTSD and the variety of causes that can contribute to its development. We'll see that trauma in a variety of contexts can contribute to the development of PTSD. We'll also be looking at the symptoms of PTSD and some of the treatments. What about this one? There are no positive effects of stress. I mean, who wants stress, right? Do you think this statement is definitely false, mostly true, or definitely true? What do you think? If you selected definitely false, you're right. Stress, while it can certainly have a lot of negative effects on both our physical and mental health, stress can have a positive effect on us. We'll be looking at the positive effects of stress, and we'll also be exploring how our thoughts about stress can affect how stress affects us. In the first section of this video, you're going to be learning about the nature of stress. So you're going to learn how common it is. You're also going to be learning about the different types of appraisal, both primary and secondary appraisal. You're also going to be learning about something called ambient stress, and that's the stress that's sort of in the background, that is just pervasively present, and how that affects us. And then you're also going to be learning about how culture and ethnicity are related to stress. So let's get started. Stress generally refers to two things. We generally think of it as the psychological perception that we have of pressure. And then on the other hand, we might think of it as our body's response to it. And this involves multiple systems, from metabolism to muscles to memory. I think as we typically think about it in our everyday lives and we define it, we think of it in the way that your book describes it, in that it is any circumstance that threatens or is perceived to threaten our well-being and then taxes our coping abilities. So let's think about stress in that way. Let's think about it as any circumstance that threatens or perceives to threaten our well-being and then taxes our coping abilities. Stress is very common. And we know that both major and minor problems can be stressful. And we also know that even daily hassles, like someone who's taking too long to pay at the grocery store, and maybe it then makes us have to wait an extra long time, or it could be that we're running late because of traffic. Even these everyday hassles can have a negative effect on our well-being. And these stressful events, as most of you know, can have a cumulative effect. I think it's very important for us to remember, though, that some stress is necessary for all of our living systems. And what this means is that, we need to be able to sense a feeling of danger or a threat so that we can then respond. The problem, though, is that all of these systems that we have to respond to stress, these were systems that were very, very beneficial for our ancestors. And they still have some benefit, of course, but life is very different today than it was for our ancestors. And yet our biology isn't very different. And so those things that are potentially threatening by today's standards, running late for work or for class, and then this causes a stress response in your body, those things really don't require a stress response. And so these hassles, these stressors, can cumulatively affect us and overall have an effect on our health and well-being. And the reason that they can have an effect on our health and well-being is because stress has an effect on our biology. Specifically, it can cause the fight or flight response, and it can cause changes in hormones. It can lead to increased inflammation throughout the body. We'll be looking at several different consequences of stressors in this chapter and in the next one. So I wonder what you think. Do you think modern lifestyles create more stress than they did in the past? And if you do think this, how so? This question reminds me of the paradox of progress that you learned about in the first chapter. So do you think that our lives today are more stressful than, say, your grandparents? Or let's go back hundreds, if not thousands of years ago. Do you think life today is more stressful? Or do you think we just have different stressors? How does life differ? And do these differences create more stressors? I know people who've said that they want to live off the grid. For example, I remember a few years ago, my brother saying that he was planning on doing that he wanted to disconnect from electricity, he wanted to grow his own food. He didn't really fully end up doing that, but I think that he was feeling the pressures of everyday society, and he wanted to also be very self-sufficient. And I wonder, as I hear people say things like that or have those wishes or desires, if there's a thought that life was less stressful when things were simpler. Or think about the Amish people, for example. Are their lives less stressful, or do they just have different stressors? And then do we think about stress in a different way today than we did historically? So some interesting questions for us to think about as we move into this chapter on stress and its effects. Have you ever noticed that one thing that might stress you out doesn't stress out your friends or your family, or vice versa? Well, this is because, as each of us knows, stress is subjective. In other words, not everyone feels the same degree of stress from the same event. And much of this has to do with how we appraise different events. There's actually a scale that measures our perception of potential stressors, and this is called the perceived stress scale. I'm going to put a link to this on our course module under module 3, so that if you're interested in taking a look at this, you can see how you experience stress. And you might want to give this stress scale to someone else to see how they do. And this will give you an idea of the differences between yourself and others. So we each experience stress differently. And again, this has a lot to do with how we appraise events. So the first thing that we do is we make what's called a primary appraisal. And this is the initial evaluation of the relevance of the potential stressor and the level of the threat and the degree of stress that it brings. And then if we think of this particular event as being stressful, then what we do is we make what's called a secondary appraisal, or we evaluate our ability to cope. So let's look at this in just a little bit more depth. So primary appraisal is a cognitive process. And what this means is that it's a thought process. And this is when we're deciding if an event is stressful and if it is relevant. And what we're doing is we're making a decision. So again, it's cognitive. We're deciding, does this event pose a threat? Will it cause us harm? Does it present a challenge? Harm or loss is associated with damage that's already happened. Like, for example, potentially like the death of someone or a job loss. And then threat would be the possibility of a harm or or some type of loss in the future, like maybe sickness or poor job performance. And then challenge consists of events that provide a person an opportunity to gain a sense of mastery and competence by confronting or overcoming a dilemma. And so this particular type of stress, this challenge, sounds different from the other two that I just mentioned. It sounds very different from harm and loss, and that's because it actually can be seen as a positive type of stress. But still, this can cause many different consequences to our body because, again, it is a stressor. And so this particular type of struggle is positive, but it can still expand our knowledge, expand our experience. It might allow us to develop tools or to embrace future challenges. Maybe this could include things like finishing a marathon, or maybe you want to write a book. So that would be an example of a challenge. So these are types of events that we then appraise and we determine, are these things stressful or not? And then secondary appraisal is also a cognitive process. Again, cognitive meaning how we think about that event. And this happens when we're figuring out how can we cope with this particular stressful event. So we decide what coping options are available. So for example, let's go back to the harmful event. A harmful event requires immediate evaluation of coping options because it's already occurred, right? And then a threatening or challenging event, these allow for, this allows us some time to gather more information. So these have some different elements to them that can require us to think differently about these stressors, and we may then have different evaluations about our ability to cope. And if we've previously coped with these types of stressors, whether it be a harm, a threat, or a challenge, then these can actually serve as a frame of reference for us to help us to decide if we do actually have those options or resources that are available to help us to deal with that particular situation. So while some people may be pretty good at dealing with those types of stressors that are associated with um, harm, those that may be because they've had those experiences in the past, but they may not be as good at dealing with those stressors that revolve around threats. And then some of you might be very good at dealing with stressors that are involving challenges. I think especially as students and you're trying to balance things like work and home life and school, you can become pretty adept at being able to manage those types of stressors, those challenges. So oftentimes it's our previous experience that can help to contribute how well we think we're going to be doing, or contribute to our perception of how well we think we're going to do during this secondary appraisal process. So if we have this particular event and we then notice, we think to ourselves that the situation isn't very harmful, it's not very relevant, it's not a challenge, it's not a threat, then there's no stress. But if we see that situation as challenging, as threatening, or harmful, then we're going to ask ourselves, do we have the coping resources? And if we feel like we have the resources, then we're not going to experience the stress. If we do feel like we have, or if we don't feel like we have the resources, then we are. So what we need to do is develop those resources so that when we do encounter those threats, harmful events potentially, or challenges, that we then experience lower levels of stress or even no stress at all. So the real key here is having those coping resources. And we'll be looking at that more in this chapter, and we'll look at that also in our next chapter and in chapter 5. Sometimes stressors are not very obvious. They may be those things that are subtly in the background of your environment. This could include things like living in a noisy apartment building. It could also include things like living in an area with a lot of pollution. It could be, having a roommate who maybe doesn't take very good care of their environment, and so that you smell dirty dishes and dirty clothes, and those things can be very taxing on a person. And these are sources of ambient stress. So this is that background noise. It's the chronic negative conditions that are embedded in the environment that you're regularly exposed to. And these can cause an elevation of stress hormones. And if you look in your textbook on figure 3.3, you'll see an example of this, of how our stress hormones can increase as a result of those things that we might not think of as being that stressful, but actually can cause some physiological changes. I know for myself, I'm very sensitive to loud noises. And so if there's a lot going on in the environment, and I have 3 kids, so there generally is, but if they've got the TV up loud, or maybe there's a lot of, like, my sons, maybe they're fighting with each other, or they're wrestling, or whatever it might be, and maybe they're annoying their sister. All of those are sources of stress for me for multiple reasons, but one reason is because of the noise. And so I have to recognize that. I have to find a place in my house, especially if I notice this is happening in my body. I'm noticing the increase in heart rate. I'm noticing that physiological arousal. Then I have to sort of step away, maybe take a moment outside just to get some fresh air and have a little bit of quiet to help myself to get back to that state of homeostasis, that balanced state of functioning. Because kids are going to be kids, and I don't want them to have to change their behavior necessarily just because I'm a little bit more sensitive. At the same rate, though, I do need to make sure I take care of myself so that I'm not continuously stressed because of my sensitivity to loud sounds. So I wonder, for each of you, what tends to affect you that might be these background environmental variables? For some of you, you may not even notice them. For others, you may be very sensitive to them. And so, think about what can you do to help to manage those experiences without having to tell other people what to do and change what they're doing. Of course, people should be thoughtful of you as well, but we want to find that balance. We also know that stress can be affected by culture, and culture affects what types of stress we experience. So let's first think about what we mean by culture. And this includes the set of ideas, beliefs, or expectations, behaviors that are shared by a specific group of people. And when it comes to stress, a person's culture can affect their experience in many different ways. And these include things like the types of the stressor that they're likely to be exposed to, the way that these stressors are perceived or understood, the extent of the physiological stress response produced, and then the coping mechanisms that are available to deal with the stressors. So different cultural groups all have different geographical, different economic and political experiences, as each of you know. And so then they're going to be exposed to different types of stressful events. So, for example, probably for many people in this country, or we may think about some countries in Western Europe, they're likely to think of stress as, or define stress in terms of, let's say, for example, the workplace, like being overloaded at work, maybe having a lot of expectations, or the social environment, maybe issues with family relationships, or economic factors, which might include debt, for example. And in other cultural contexts, there may be different stressors that are going to be experienced. So they may, for example, in some parts of the world, be more prone to experiencing earthquakes or floods. Or think about even just geographically in our country, in the United States, we know that there are certain regions where they are more prone to have certain environmental or weather issues. So think about during certain times of year where people in certain parts of the US are more likely to experience tornadoes, or think about in California where there might be in certain areas a greater tendency for them to have mudslides. Or in other parts of the world, some people are affected by war and famine, and this then makes daily survival very difficult. And so this then, of course, would make those sorts of worries that we have in this country or many other places in the world, where we may worry about having too many responsibilities at work or family issues, it might make those sorts of issues actually seem almost irrelevant, because people in some places in the world are just trying to survive. And then we have variations in this country. Think about economic variations where we have a large portion of people, especially now, who are really stressed because of living in poverty, perhaps not knowing if they're going to be able to pay their bills. We could also think about discrimination in the workplace. We could think about some groups who may fear some of the real negative physical consequences of in some parts of the world because they're in the minority. Think about in some places in the world where certain groups have been targeted because they're in the religious minority, maybe they're in the racial minority. So all of these are part of the cultural context of stress. And then I think perception is another variation here, or another factor that we want to think about. So for example, if we think about parts of Southeast Asia, like in Korea, maybe we think about Japan, academic success is given higher importance than it is in the US and in many parts of Western Europe. And this is reflected, I think, in the degree of educational stress that is reported, and many of you probably know about this, by students who are from those countries. And so, for example, in Japan, there are they're not very infrequent, pretty frequent reports of students who are committing suicide because they've not passed an exam. And these sorts of occurrences, maybe they're not unheard of in the US or parts of Western Europe, but they're certainly not occurring at the same rate because of academic issues. Maybe, they're occurring. We're still seeing suicide, of course, but the cause is different here than it is in other parts of the world that have different types of stressors. So perception is another particular factor I think we want to think about. And then cultural change is a major source of stress in most cultures. Think about many people who move to different parts of the world to seek new opportunities. Maybe they're trying to escape war, they're escaping famine, and perhaps they may be refugees, or maybe they move to other parts of the world because they are wanting to be a student at a university. And so these can be major sources of stress and then can have a physiological effect and psychological, of course, on the person who's experiencing that new culture. And this is an older study, but I think it's a great example when it's presented in your textbook of that ambient stress and how it can affect our overall health and well-being. And there have been many studies since this one that have shown similar types of findings. So in this particular study, what they did is they compared children from noisy areas near Munich International Airport with similar children from quiet neighborhoods in the same city. And they found elevated levels of both epinephrine and norepinephrine, and these were associated with stress reactions. And this happened in those children who were exposed to high levels of noise at the airport. We'll be looking at what these hormones do and what the effect is on our health. So think about kids who live in noisy environments. We often, if you live in a noisy environment, you get used to it, you think. You're not noticing it, but it does serve as this background noise. In other words, it's that background stressor. It's a background source of arousal that you're not even necessarily noticing, but can affect your health. So overall, if we think about people in the United States, about half of Americans say they're dealing with a moderate level of stress. But I think it's important for us to note, and what you'll see in this chapter later, is that all stress is not bad. It actually, what you'll find is that it can make us more aware of things that are around us and help to keep us more focused. But it can have a negative effect on our health, especially if we don't have the coping resources. What you learned so far is you learned about the nature of stress. You learned also about primary and secondary appraisals of stress. And you learned about ambient stress and some of the research on this as you looked at the effects of ambient stress on hormone levels in that study that was done on children in Munich. You also learned about how culture and ethnicity are related to stress. In this next section, we're going to be looking at major sources of stress. You're going to be looking at acute and chronic and anticipatory stressors. And I'd encourage you to be thinking about which of these stressors seems to affect you the most. I think often I do hear students say that Anticipatory stressors can be pretty stressful. I also hear students say that chronic stressors seem to be the most stressful for many students. But I think we're each different, and it depends upon those stressors that are fulfilling those different categories. So think about which ones do you think are affecting you. We're also going to be learning about frustration and the different types of internal conflict. We'll look at something called life change. When we look at this, we'll be looking at something called the social readjustment rating scale. And this particular scale was developed by researchers named Holmes and Ray. And what they wanted to do is they wanted to see if there was a relationship between life change and illness. And so life change could be something really negative, or it could also be something positive. But change, they thought, could lead to illness. So we'll be looking at that. And then you're also going to be looking at pressure and how that can be a source of stress. So let's get started on this section. There are three basic categories of stressors. These include acute, chronic, and anticipatory stressors. Acute stress is short-term stress, and chronic stress is long-term stress. Some examples of acute stress could be a stress that you experience for a short period of time, like being in a traffic jam or being in an argument with your significant other, or maybe receiving criticism from your boss, or someone breaks into your house when you're not there. Those are all short-term stressors. But sometimes these stressors can turn into chronic stressors, and sometimes stressors just begin very subtly and stay present in the background. They're almost like those ambient stressors, and they may rise to the surface and become more intense, and they just continue to be present. So ambient stressors can increase in intensity. Acute stressors can just become chronic stressors. And so chronic stressors are threatening events that have a relatively long duration, and we don't know when they're going to be ending. So maybe you're a bus driver and you get in numerous traffic jams every day. So we don't just have one stressor, that one acute stressor, but we have this chronic one. Or maybe you're in a bad relationship and you argue with your partner constantly. Or maybe you work for a toxic boss. Or maybe you live in a high crime neighborhood and break-ins happen pretty often. All of these are acute stressors that can turn into chronic stress. So our body is pretty good at handling episodes of acute stress. We're designed to recover quickly from these short-term stressors. In essence, what we are doing when we recover is we're being resilient. And so when we're recovering quickly, this is an indicator of our level or of how resilient we are as individuals. So we start out with a high, our increase in blood pressure, an increase in heart rate, an increase in breathing rate. We may have muscle tension, and all of this can really skyrocket for quite a while. But if you're pretty healthy, then these markers of stress, they can quickly go back to their normal levels. But the body isn't so great, as many of you have probably noticed, at handling chronic stress. And over time, chronic stress gradually increases our resting heart rate. It gradually increases our blood pressure and our breathing rate and the levels of muscle tension that we have. So our body's now having to work harder when it's at rest just to keep you functioning normally. So in other words, what chronic stress is doing is it's creating a new normal inside of your body. And this then can lead to lots of different health problems like high blood pressure, heart disease, chronic pain, and depression. We'll look at some of the things that you can do to deal with chronic stressors. But just for a moment, I just wanted to share some of the things that maybe you're aware of that you can do. Those include things like exercising. The research suggests that regular exercise can have a very positive effect on mediating the effects of chronic stressors. That could include just taking a daily walk for 30 minutes. This can be very helpful, especially if we're talking about trying to get back to what our body used to be like before this stressor was present. Other things we could do would be meditation and yoga, deep breathing. There are lots of different apps that we can use that can help to remind us to do these things and can provide us with some guidance as we try to experience relaxation and reduce the effects of chronic stressors. Anticipatory stressors are those things that we anticipate or we expect are going to be happening, and they're thought of as being threatening. We can think of these anticipatory stressors also as anticipatory anxiety sometimes. And so this is happening when we don't have enough information available to us about what is going to be happening next. And so it's not really if we think about the anxiety associated with anticipatory stressors and anticipatory anxiety, we wouldn't think of that necessarily as a diagnosis, but it can become a symptom of other types of mental health disorders like panic disorder and generalized anxiety disorder. And anticipatory anxiety, that worry that you have about future events that you don't really know where you don't know what's going to happen, that can be very treatable. And we're going to be looking at what you can do to reduce that anticipatory anxiety that you might have associated with those stressors. Some other categories of stressors are frustration and internal conflict. We all know that life is full of frustrations. These can include things from minor irritations, like maybe losing something, misplacing your keys or your phone, to finding out that your phone is actually in your pocket or already in your hand as you're looking for it. Some of you may have experienced that before, especially if you're under a lot of stress. This is more likely to happen where you become very forgetful or you overlook things that might be very obvious. So this can happen to a major problem of maybe having a continued failure towards a desired goal. And so since many of the things that we really want require a degree of frustration, it's important that we're able to manage frustration. And we'll be looking at that in this chapter and the next two. And so frustration actually is not a abnormal experience. It's actually very typical, and it is necessary if we want to grow and experience a positive life. So it's an emotion that happens where we're blocked from reaching a desired goal. And whenever we reach one of our goals, we feel pleased, right? And then whenever we're prevented from reaching our goals, we might become very frustrated. We become irritable, maybe annoyed and angry. And then the more important the goal, the greater the frustration, and maybe you might feel more uncomfortable feelings. Maybe you feel anger, you might lose some confidence. But frustration is not necessarily bad because it can indicate the problems that are in our life, and it can actually result in motivation for us to change. But when frustration results in things like irritability and anger, stress, resentment, depression, or where we spiral downward, where we have maybe a feeling of resignation, where we give up, then frustration can be very destructive. When we experience frustration often, when they're extreme or when they're prolonged, the stress of this can strain us, and this then can have an effect on our health. And this can affect us mentally as well, of course. So it might lead us to have anxiety, it might lead to headaches, depression, it might affect our digestion, which can lead to stomach aches, it might lead to high blood pressure. I know I'm prone to migraines, and when I'm experiencing stress, I'm more prone to have those migraines. It can also lead to an increase in risk of heart disease because of the overall physiological changes that are happening in response to frustration. Another source of stressors are internal conflict, and this occurs when we have two or more incompatible motivations that are competing for expression. So let's take a look at these. So there are three types of internal conflicts. There's approach, avoidance, and approach, avoidance. So when you have this internal conflict of approach, this is where you have two desirable things that you want, but only one option can be chosen. So I really want to go on a ski trip, but I also want to go visit my family that I haven't seen in a while. So I want this, but I also want that. Avoidance, this is where you have two unattractive alternatives. So I don't want this and I don't want that. I don't want to study and I don't want to do the dishes. And then there's approach avoidance. And this is where you have one goal that has both positive and negative sides to it. So I want to do this, but I don't want to have to do what it entails. As you think about these conflicts, you might ask yourself, so what is the big deal? Are these internal conflicts really likely to have any type of effect on me? And what's their relationship to my health? Well, when we experience these internal conflicts, they are having an effect on our internal sense of peace. And the consequences of these internal conflicts, if we feel as though we may not have made the right choice, can lead us to have a sense of resentment. They can increase our feelings of overall anxiety and worry. They really can take those cognitive resources that we should be using to do healthier things for ourselves and direct those then to these types of worries or conflicts that we have. So if we ruminate, and in other words, if we think a lot about these particular internal debates or struggles that we have, then this can have a negative effect on us psychologically and physically. We're taking those resources that we have, those cognitive resources, focusing on how are we going to manage these conflicts, and also which choice should I make? I'm afraid of making the wrong choice. That's taking a lot of energy. And then there's that worry. So then think about how that worry can affect your health. Think about how worry affects your ability to sleep well, how it affects your relationships. It can increase irritability. It can increase feelings of anxiety. It can increase some of the symptoms that one might have of depression. So internal conflict can have a very real effect on each of us if we don't know how to resolve those conflicts. And again, what we're looking at here in this portion of the module is we're looking at these different sources of stressors. And then we're going to be looking at the effects of these, and we're also going to be looking at what we can do so that we don't experience such negative consequences from stressors, so that we have the resources that we need. So let me ask you all this question. What do you think? Do you think that very stressful life events can predict future illnesses? If so, why do you think that? Well, two researchers in 1967, Holmes and Ray, thought so. And they combed through the medical records of over 5,000 patients with an eye to seeing if there was a connection between illness and the most stressful life events. And they found that a strong correlation did exist. Remember, correlation does not mean causation, but you cannot experimentally expose people to lots of stressors that we see in everyday life and measure the effects of these stressors on their overall health. Now, we can artificially create stressors, and we'll look at that later on, but we can't do things like put someone in prison. We can't, force them to lose their job. We can't do those sorts of things experimentally, so we have to rely on correlational research. So the correlational research that they did resulted in correlations that were so strong that they ranked stressful situations on a scale from most stressful to least stressful. And these could indicate which life stressors put people at higher risk for becoming ill as a result. And so this then became part of what was called the social readjustment rating scale. And you can see items from this scale on figure 3.5 in your textbook. And this is also known as the Holmes and Ray stress scale. And then the same researchers tested their reliability of this scale again in the 1970s. And what they did is they gave the scale to 2,500 US military members, and they asked them to rank their most stressful life events. And then they followed the sailors for 6 months. And what they did is they tracked their visits to see doctors that were at the military sites where they lived. And they found that what they wanted to do is they wanted to know if there was a correlation between their reported life stress and their visits to the doctor. And the study showed that there was, number one, reliability of the scale, so that when they were regularly giving this scale, and they repeated giving the scale to the sailors, that they were seeing that the results were consistent. And then they also found that there was a correlation between reported stress and illness. So in other words, the stress was associated with illness, and more specifically, the more stressful the event, the higher the likelihood of the illness. And they actually found that this result held true cross-culturally. So they looked at people who lived in Japan, and they looked at people in Malaysia, and they looked at people, of course, in the United States, and they found that this relationship existed in those different, environments as well. And they also found that there was a correlation between stress and illness among different ethnic groups. So among African Americans, Hispanics, and Caucasians. So this seems to be a relationship that exists cross-culturally and it exists across ethnicities. So they're definitely, based on their research, they were concluding that there's a relationship between stress and illness. And the more stressors we experience, the greater the likelihood of us experiencing illnesses. So what are some of the most significant life events that can lead to illness? Well, first of all, what we're talking about are what are called life changes. And these are any noticeable alterations in our living circumstances that require readjustment. So let's look at some sample items. So here are some sample items from the social readjustment rating scale. And some of those that are ranked at the highest include the death of a spouse or child, divorce, marital separation, imprisonment, death of a close family member, personal injury or illness, marriage, dismissal from work, marital reconciliation, and retirement. For many of you, you may think, well, why is marriage here? Well, marriage requires life change. It's not that we're looking at marriage as a good or a bad stressor. It's what kinds of changes are you having to make in your life as a result of these stressors. Many of you have heard of what are called distressors, eustressors, or distress and eustress. And distress are those stressors that we think of as negative, and eustress would be stressors that we think of as positive. But our body doesn't see them very differently, first of all. And then secondly, it's not so much about the stressor, according to Holmes and Ray, as much as it is about the adjustment that we have to make in response to that particular stressor. So what I would encourage you to do is to take a look at this scale and to identify those things that you have experienced in the past year. And then you can total up your score and you can see what your complete score is after doing that. So maybe you have 5 items here that you've experienced. So pause the video, identify those items, and then total up your score, and I'll share with you what the results mean. Okay, so these are, in this particular scale, these items we can total, and then they can tell us what our likelihood, based on the research, is of becoming sick or developing some kind of illness. So if you had a score that was over 300, you have a likelihood of becoming ill of 80%. So you have an 80% likelihood of becoming sick, and that's going to be in the next year. If you have a score of 150 to 299, your likelihood is 50%, and then 30% is if your score is less than 150. So lots of different potential stressful events, but I do want to point out that many of you probably experience stressors that are not listed on here. You experience life events that require adjustment and change that also can contribute to this. So there are some additional questionnaires. I'll post those on our module so that you can take a look at them. One of them is related specifically to college students. So you can take a look at that and see what your own level of stress is based on being a college student, and then get a sense of how likely you are to experience illness as a result of these particular stressors. Another source of stress is pressure, and we can think of pressure as being in 2 different categories. We have the pressure to perform and the pressure to conform. So pressure to perform happens when we're talking about performance, and this can be revolving around work situations, so maybe presenting at work or how well you're doing your job at work. Performance can be academic performance. It could be doing something that really seriously counts, like saving people from a burning building as well. Or maybe you are in a big, in a sporting event and you're playing the winning match. Maybe you're a tennis player. So it can be everyday performance, but it could also be significant events or very meaningful, important events. So what's interesting, I think, is that first of all, these pressures can have an effect on our health. But secondly, is that there seems to be some variations between men and women in terms of how these are experienced. So in terms of males and females. Now, I want to point out too that later we're going to be looking at gender. We'll look at gender and gender stereotypes and the pressures that males and females experience. We're also going to be looking at how when we think about gender, we need to think about it outside of this binary way where we think of males and females. Most of the research on gender does look at gender in binary terms, and that's not because that's how researchers do currently think about gender. It's just that's how historically research has been done, and now we're seeing some changes in that. So when I talk about differences between males and females, I'm just sharing with you because this is based upon research where they identified or where people self-identified as males or females. So they had those options within the research study. And so in the research where they have looked at the pressure to perform in the differences between males and females, what they found was that there seems to be differences that males and females experience. So it turns out that what they found is that women report being brought up differently than men when it comes to performance. So, studies of male and female differences in how males and females respond to these performance challenges show that males, they tend to, as many of you maybe have experienced in your own life, they're more likely, and these are generalizations, but there are definite differences. There are always going to be exceptions, but they are more encouraged to get back into the game than females are. So in other words, males are more likely to be sent the message that mistakes are inevitable and resiliency is prized. Whereas females have been more likely in studies to report getting the message that they need to get it done right the first time, and that they also need to make everything okay for other people. So think about then how this translates into the workplace. So if, let's say, you're in the workplace, your supervisor, your boss is evaluating your performance. For women, they may have had a stronger message that being perfect is important and it is to be valued, and that's what women need to be doing. And so when they're experiencing criticism, on average, women may be more inclined to experience stress from that criticism. They may feel, much more negative effects from that criticism than males. Now, again, there are always variations in these experiences, and we're talking about generalizations. But this is interesting, and it's interesting for us to think about how gender norms and stereotypes can affect how women and men see themselves when they are not performing up to the standards that they think they ought to be. And so it's interesting for us to think about what are these effects? What are the effects of these expectations on men and women? And the effects meaning, what are the stress effects? How is this affecting them psychologically and physiologically when they're not performing as well as they would like in certain areas? And then we have the pressure to conform. So when we think about pressure to conform, we may think about this as a pressure to follow a more traditional path or to follow the expectations of others. And of course, these paths vary depending upon where we live, depending upon our family, and depending upon the time within which we live. And so things would be very different for, let's say, your mother versus you if you are a female, or your father versus you as a male. So there are lots of things that, of course, impact our mental and physical health, but one that seems to sort of be present, it's omnipresent, it's present so often, is this pressure that we get from friends and family, and even just from society as a whole, based upon culture and norms. And so these are pressures that we may face on a day-to-day basis. And again, they're coming from people who are in our families, our friends, the communities we live in, and society as a whole. And these can affect the choices that we make. And we may feel that we need to make certain choices in order to follow certain paths or to please other people because those people are expecting certain things from us. And this then can lead to stressors. So we have these constant decisions that we're needing to make every day. Many of them are very small, some of them may be big. And these decisions that we make then can really be directed by the pressures that we feel to conform, to do what others expect. These may be decisions that are very simple, like what should I eat for breakfast? Or what should I wear today when I go to work or school? Or should I get married? Or who should I marry? Or when should I have kids? Or should I stay at my job? Or should I look for a new one? So think about each of these decisions and how they may be inevitably impacted by those people who are around you. So society as a whole says to us, provides messages to us about how we should dress, when we should get married and have kids, if we should get married. And so all of these are communicated through norms and through our culture. So these norms, they're basically there are these unofficial guidelines. No one's necessarily directly communicating this to us, but there are these unwritten rules that have an impact on how we behave and the choices that we make. And these vary, of course, in many places throughout the world. We're going to see lots of variation, but we feel the pressure to do this. And so while culture can be a beautiful thing and norms can be helpful in guiding us into maybe acting in a certain way that might be best for the group as a whole, they can definitely have their downsides. And sometimes these, when we think about norms, we think about culture establishing norms that maybe apply to the majority and are not taking the needs of everyone into consideration. So this can be very stressful when you are not fitting within that majority. And it doesn't have to be in major areas of your life. It can even be in small areas of your life where you're not fitting into that majority, where you're experiencing those pressures. But think about people who are not fitting into the majority in the big areas of life. People who may decide that they don't want to have children. People who maybe decide that they don't want to get married, or people, and there are lots of areas. People who may be, who let's, think about a person who is gay, and think about how that person may feel the pressure, especially of older generations, to conform, and may not feel free then to be who they are, and have the relationships with who they want to have. So these can be tremendous pressures that can have a significant effect on mental and physical health. So take a moment to reflect. How do you think you create stress in your own life? For example, do you make small mistakes out to be bigger in your mind? Do you catastrophize? Do you maybe make a mistake at work, or you don't do as well on a test as you would have liked, and you exaggerate it in your mind, saying things like, I'm never going to be competent, I'm never going to graduate, my boss isn't going to think that I'm competent? Those are exaggerated thoughts that can impact our overall sense of well-being, and they're really increasing our stress level. Do you ever find yourself trying to predict the future and trying to find as many possible things that could go wrong? While it's important to plan, do you do this so that it's contributing to your overall stress level and leading to feelings of anxiety? Are you thinking in a black and white way? Do you see things as either good or bad, right or wrong? And I think it's important to note that the more rules that you have for living, the more life will break them. And this then can create your own stress. And we need to keep in mind that we have to give ourselves grace, and life has a lot of gray. Do you generalize? Do you generalize one bad experience and then make it out in your mind as though that one bad experience is going to be characteristic of all things that you do? Or do you have a tendency to compare yourself to other people? Do you look at other people's lives and think that yours isn't as good? Do you think about where you are in your life academically or professionally, or do you compare yourself in terms of physical appearance? Are you making these comparisons, and is this contributing to stress? We're going to look at the power of thinking some more in our module, where we're going to be looking at how we can challenge those thoughts and we can then reduce our stress levels. So take a moment to test yourself. What do you think this is describing? Blank are circumstances that threaten or are perceived to threaten one's well-being and tax one's coping skills. If you don't know what this is, maybe go back in your notes, maybe pause the video. I'm going to go ahead and move forward. The answer is stress. Stress is described as circumstances that threaten or are perceived to threaten our well-being and tax our coping skills. Let's look at another one. Blank is the initial evaluation of whether an event is irrelevant, relevant but not threatening, or stressful. So what is this? If you don't know, pause the video, go back in your notes. If you think you know, go ahead and continue. The answer is primary appraisal. This is the initial evaluation that we make of whether an event is relevant or irrelevant. Is it threatening? Is it not threatening? Let's move on to another. Blank is the evaluation of our coping resources and options for dealing with stress. This is related to the last one, so take a moment, think about this, and if you don't know the answer, again, pause the video, go back in your notes. If you do think you know it, you can continue. And the answer is secondary appraisal. This is the evaluation of our coping resources and the options that we have for dealing with stress. Here's another one. Blank is a set of chronic environmental conditions that are negatively valued and place adaptive demands on people. So what is this? And this is a type of stress. So what is this? It's that background noise. If you think you know the answer, go ahead and continue. If you don't, take a look in your notes. The answer is ambient stress. These could be things like noise, pollution. These are things that are in the background that are affecting us that we may no longer seem to pay much attention to, but they still affect us. This can be related to the study of children who were living near Munich airport. And so you'll notice if you go back and you look in your textbook that their hormone levels were affected. And you'll notice that there was an effect because of this ambient stress, this noise in the background, literal noise in the background by living near the airport. And what about this one? Blank is the act of changing to adapt to a new group's set of beliefs and customs. So this can be stressful. Think about people who are newly immigrating to this country. Think about yourself. If you were moving to another country, I think if you move even to another region in the United States, some might argue that there is a little bit of this that's happening. It's certainly much more intensive when you're from a completely different country. But what is this? If you know the answer, continue. If you're not sure, again, go back in your notes. Let's take a look. The answer is acculturation. This is the act of changing to adapt to a new group's set of beliefs and customs. So for those of you going into the helping profession, think about this. Think about people who are newly immigrating to this country and the barriers that may exist to getting treatment. They may be especially prone to developing anxiety or depression, but there may be language barriers, knowledge barriers. So it's going to be important for mental health professionals to find ways to reach out to people who may be in that community who are not knowledgeable of the resources that are available or who do have language barriers. So what have you learned so far? Well, what I've done, first of all, is I've divided this chapter into two parts. So this was the first video of two for this chapter. And in this video, you learned about the major sources of stress. You learned about acute, chronic, and anticipatory stressors and some of the effects of these stressors. You also learned about frustration and the different types of internal conflict and the effects of this conflict or each of these types of conflict on us. You also learned about Holmes and Ray's study on life change, and you learned about their social readjustment rating scale. And then you also learned about the role of pressure on our psychological and physical health. You learned specifically about the pressure to perform and the pressure to conform, and some of the research on gender differences in terms of the pressure to perform. I've divided this chapter, chapter 3, into two parts. So in our next video, you're going to be learning about how we respond to stress. You're going to learn about the negative emotions that are commonly elicited by stress, and you're also going to be learning about the positive emotions that can happen during the stress process. You'll be learning too about the effects of emotional arousal on coping efforts, and you'll learn about something called the inverted U hypothesis. You'll learn too about the fight or flight response, and you'll learn the difference between that and the tend and befriend response. You'll also learn about post-traumatic stress disorder, how often it occurs, some of the causes, and you'll also learn about the symptoms. You're then going to be learning about the effects of stress on physical health. So we're going to be looking at exactly what's happening to our bodies when we experience stress. You're going to also learn about how stress can have some beneficial effects and what we can do to tolerate stress. We're also going to be exploring the role of social support and something called hardiness, and we'll also be looking at optimism. So I look forward to seeing each of you online, and I would encourage you to be sure to be reading your textbook, answer some of the review questions throughout, and then also I'm having some practice questions for you that you'll find on D2L for each of the chapters that I hope will familiarize you with the types of questions that I'd like for you to answer for our exam that we'll be having, that will be covering chapters 1 through 4. I'll see you online. Thank you.